Now let's turn our attention to a disturbing trend of slumping and deaths sending shockwaves across the country as health experts sound the alarm, urging Nigerians to prioritize health checks. Adebola Adedugba has more in this report.
Having your vitals taken has become imperative in our society as Nigeria grapples with an alarming trend of sudden deaths owing to inexplicable slumping. On the 3rd of June 2024, the Deputy Commissioner of Police, Abubakar Muhammad Guri, was found dead in his office after slumping in his chair. 3 weeks after another casualty was recorded, one of the senior officers of the Nigerian Customs Service, SCN Andrew, also slumped and was pronounced dead a few hours later. Sad news once again rented the air a month later as Nigerian Senator Ifeanyi Uba, representing Anambra South District, died as a result of a cardiac arrest. Thinking there had been a lead over the sad happenings, there comes the sudden demise of Nigeria's iconic singer and songwriter Onyeka Onwenu, affectionately referred to as the Elegant Stallion, who slumped and died after performing at a private function. As Nigerians remained baffled with all the sad happenings was another addition of the Ogun resident electoral commissioner, Barrister Niyi Ijalaye, who slumped and died in Abuja. This doesn't just happen to prominent people. According to the World Health Organization, cardiovascular disease is responsible for the deaths of an estimated 17.9 million people each year.
Mo máa ń yẹ̀ wò kódà gan máa tún ṣe yẹ̀jẹ̀ wò mo máa ń yẹ̀ wò dáadáa ṣé bẹ́ẹ̀ ni tó bá jẹun kánú ilé ó máa sọ pé òun máa ṣẹ́ẹ̀kì ara òun wò kò sóúnjẹ nínú.
It's been long ago. It's been a very long time. Over 10 years now. Ṣé person wey never chop go say wan go check BP? BP kẹ̀ báwo mi fẹ́ check ẹ̀ báwo adébẹ̀ sọ bá ní kìlọ́mọ́ wa ní kí tó check BP nǹkan tá à ń ṣe lọ́fẹ̀ẹ́ tẹ́lẹ̀.
The commonest risk factor for people slumping and dying still remains hypertension worldwide. So hypertension is persistent and persistently elevated blood pressure greater than 140/90. And when your blood pressure is high, you need to attend to it, because if left unattended to, it can lead to a whole lot of complications. And many of those complications are what is responsible for people slumping and dying. And if you check and it's normal, then you don't need to, check all the time. So maybe you can check once in 3 months, once in 6 months. But if you check and it's abnormal, then you need to start, that will take us to treatment. Then, of course, there are 2 major ways in which we address blood pressure. The drugs that you take, that's the pharmacological method of addressing your blood pressure, and the non-pharmacological methods, which are lifestyle changes.
Statistics from the World Health Organization indicates that by 2030, almost 23.6 million people will die from cardiovascular diseases, mainly from heart disease and stroke. These are projected to remain the single leading causes of death in the world. Hospitals are often besieged by people on a daily basis. But how many are here to check your vitals and prevent sudden death? In Lagos for News Central, Adebola Adedugba.